Robert F. Kennedy Jr., poised to take on a role in President-elect Trump's administration, riding his third-party bid turned endorsement, telling NBC News' Vaughn Hilliard this week.
What I'm going to do is make sure that Americans have good information, the best gold standard science about their food and medicines, and then leave the choice to them.
RFK Jr.'s views on science and medicine have been controversial at best and often scientifically wrong. He's touted debunked studies that connect vaccines to autism, disproven by much research, with the CDC clearly stating there's no connection between the two. And now RFK is talking about another hot-button issue, saying he will advise cities to remove fluoride in drinking water.
I think fluoride is on the way out because of that court decision. I think the faster that it goes out, the better.
The court decision he's referring to is from September, when a federal judge ordered the EPA to further regulate fluoride in drinking water. The determination stemming from a U.S. government report from the National Toxicology Program, concluding that fluoride at 1.5 milligrams per liter, twice the recommended amount in U.S. drinking water, is linked to lower IQ levels in children.
It's lowering IQ in our children.
But that's not exactly what the study said in the U.S. It said, quote, no studies evaluating IQ were conducted in the United States. It was based primarily on data from non-U.S. countries, including Canada, China, and Mexico, getting higher levels of fluoride. It also found that about 1.9 million people, or less than 1% of the U.S. population, are getting naturally occurring fluoride at levels of 1.5 or higher. Judge Chen, writing in his ruling that while it is not established fluoride levels in U.S. water is causing lower IQ in kids, the risk is sufficiently high, and the EPA still must act. Federal drinking water standards that included fluoride guidelines were first set in 1962. Since 2015, officials have recommended a fluoridation level of 0.7 milligrams per liter of water. Before that, the recommended upper range was 1.2. The WHO has set a safe limit of fluoride in drinking water at 1.5. Dr. Charlotte Lewis is a professor of pediatrics at the University of Washington School of Medicine.
By having community water fluoridation, we've essentially dramatically improved the oral health of our entire nation.
The EPA issuing a statement saying in part this: they are reviewing the decision and that it currently regulates fluoride at higher levels than what's currently recommended. The anti-fluoride movement, once seen as a fringe, misinformed effort, is now gaining steam. More communities in the U.S. voting to remove it from their drinking water as more research comes out. But those decisions not always panning out well. In 2011, Calgary, Canada removed fluoride from drinking water. Now the city plans to reintroduce it, mostly because of evidence showing more dental health problems in children there.
That's a good example of what happens when you remove fluoride. They made that decision based on faulty science.
And back here in the United States,
I'm not going to compel anybody to take it out, but I'm going to advise the water districts about their legal liability, their legal obligation to their service zones and to their constituents.
This issue likely to be heavily debated as the Trump administration, potentially including RFK Jr., taking the reins. Yasmin Vossoughian, NBC News.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.